If you're in the mental health industry and want to grow your impact, your reach, and your organization, you need to be at the Mental Health Marketing Conference. This October 7th through 9th, join hundreds of marketers, executives, and clinicians for 3 powerful days of inspiration, strategy, and networking. From AI to storytelling, from branding to market strategy, you'll leave with actionable ideas, meaningful connections, and access to industry experts. It's so much more than a conference, it's a community. Visit mhmarketing.org to learn more and grab your ticket today. Attend in person in Franklin, Tennessee, just south of Nashville, or attend online and see me as one of the keynotes. And use discount JOE to get an extra 10% off any ticket. Again, that's mhmarketing.org and use promo code JOE to get an extra 10% off any ticket. This is the Practice of the Practice podcast with Joe Sanok, session number 1251. I'm Joe Sanok, your host, and welcome to the Practice of the Practice podcast. You know, this summer has had so many amazing guests. I mean, Harvard's Bob Bordone, who started the Conflict Resilience Lab and talking about negotiations. We talked with Harvard Business Review senior editor Kevin Evers, who talked about the strategic genius of Taylor Swift, which was hilarious because he's like this foreign film expert guy who became an HBR senior editor. We talked with a bunch of different ultra athletes. Like we talked with folks who ran on all 7 continents, doing the fastest marathons all over the world. We've talked with folks that are talking about unlocking liberation and the spiritual side of meditation and ending suffering. We talked polyvagal theory. I mean, this summer has been jam-packed with just amazing guests and really just like interesting things for me. I mean, we talked about polysecure, like attachment in non-monogamy. We talked about hosting intensives. So if you missed any of that, I mean, that's just the tip of the iceberg. There's so many amazing episodes this summer. We've been doing 3 to 4 episodes every single week because of our amazing sponsors and just all that we have going on. Things are really lighting up for us after the Group Practice Boss Conference that we hosted back in May. I'm going to be keynoting at the Mental Health Marketing Conference, so make sure you find me there. Hang out with me down just south of Nashville. That's going to be in early October. But all sorts of just like really fun things. My curious side is just exploding after this summer. So if you know good guests that we should be interviewing, let us know. We're always looking for you to send people our way as well. Today, we just continue that trend of amazing voices. We have Dr. Courtney Tracy, also known as the Truth Doctor, is a USC-trained psychotherapist recognized as one of the most authentic, perspective-shifting voices on mental health and the human condition, and one of the first therapists to publicly disclose her own mental disorders. A multi-hyphenated healthcare entrepreneur and award-winning content creator, Dr. Courtney has founded 5 mental health companies, and her work has garnered more than 100 million views. She lives in Orange County, California. Courtney, welcome to the Practice the Practice podcast.
Thank you so much, Joe. Honored to be here.
Yeah, I'm so excited to have you here. Kind of the main focus of our episode is around borderline, and then we're going to talk about your rehab facility and TikTok and all sorts of other things. But let's just start with right now. I feel like since the pandemic, myself and probably 5 or 6 of my friends have got divorced, and everywhere I hear my ex has borderline. Everywhere. I swear, like everyone, it's this trendy diagnosis right now. When you look at, it on TikTok or on other social media, it's always top ranking. So no wonder you're doing so amazing. Maybe clarify for us, what's the reality of the condition of borderline personality?
Great question, because the reality does often go missed with how it has become personified through TikTok. The reality is that it is a brutal emotional mental health disorder that causes extreme suffering in the individuals that have it and in those around them. It can look like every ex has BPD if you look at the general criteria and are in the general population. But I'm excited to dive into what it really is and how no, not every ex has BPD.
What are some of the aspects of things that maybe are classified as borderline, maybe just in pop culture, that you would say that's probably not enough to really say this person has BPD?
Yeah, I think primarily it's like mood swings, intense anger, attempts to control, maybe some reckless behavior, infidelity, like things where the person just, could be significantly struggling in the relationship or have substance use issues or have anger issues. Those things present in the average person. And so it makes sense that people might think that a lot of people have BPD. But the thing is, BPD really is like emotions on steroids. And so, of
Mm,
course, all humans have emotions. Sometimes those emotions can be negative and perceived to be within a diagnosis. But really, it's this significantly out of proportion emotion, anger, self harm, infidelity, recklessness that causes it to actually become a mental disorder as we would categorize it.
mm. So what does it actually look like? Like what are you seeing is just actually happening?
Yeah. Well, I mean, when I think about the field itself, when BPD, I think we are really advancing on our understanding of it. What's happening in the brain, what is happening interpersonally, and what the real solutions are to it. And what we've learned through more research, I'd say over the last 10 to 15 years, perhaps in the last 5, is we're really getting an understanding of how the emotional or how the lack of emotional control presents and how it presents in a way that causes it to be BPD versus just, not having control over your emotions. And a lot of that has to do with the fact that the BPD brain is highly sensitive to negative events and will perceive interpersonal workings as negative when they potentially are not. And that's really the biggest trigger of BPD is it is a neurobiological brain structure issue. So someone could have anger issues or emotional issues that aren't that structural, and the help could happen far more easily. And so in the work, when I see people come in and they think that they have borderline personality disorder, they think they need to receive my entire partial hospitalization treatment for their emotional dysregulation. Sometimes I can come to find out that it's just trauma related, and not just trauma related, but in a different way where the solutions are more easily available because it isn't this personality that's ingrained based on brain structure. So, really, what I'm seeing right now is a flood of emotional overwhelm and these human beings that just they don't understand why they experience emotions and relationships so differently than other people.
Hmm. So what are some of those like signs that you might see in a loved one or even in yourself that would point to saying like you probably need some extra help?
Yeah. Well, the first thing is just an extreme fear of abandonment or rejection. Sometimes it comes up looking like rejection. And what this looks like in the day to day is it's almost like there's a tripwire that the person keeps tripping over, thinking that the people that they love are going to leave them. And what that really looks like is a fear of really themselves and being alone. And it can be hard to catch whether this is a fear of abandonment or a fear of being alone, but there's a major difference. Fear of being alone doesn't include the interpersonal aspect of it. Fear of abandonment means that you perceive someone there and then they're gone. And paying attention to that nuance when the person's becoming activated in a state of aloneness is really important. Fear of abandonment is the first criteria of BPD. But the second one that I would consider would be if you have a client sitting in front of you and they have these positive things that are happening in their life, but they aren't experiencing joy, connection, or positivity through them. And the lens of their life story is just so negative. And sure, they've had traumatic moments, but nothing to shift them that significantly, which is why sometimes BPD can look like CPTSD, which is like, what is it that happened that was so big that caused you to have these difficulties? And ultimately, it's just an entire lifetime of feeling like your emotions are misunderstood, whether that is in a not good enough environment in childhood, whether that is in an abusive or neglectful environment in childhood. It's that they have this emotional experience inside. And as they're developing, they are needing mirroring or at least understanding, and that doesn't exist. And so there's these small moments of abandonment, disconnection, rejection, misunderstanding, and judgment that the average person doesn't even know that they're doing to the person with borderline personality disorder because they don't understand the emotional experience. So the real fear of abandonment isn't being alone, it's being misunderstood and people being afraid of you.
Mm. So for those in relationships, and I don't mean just like romantic relationships, it could be, sibling, it could be a parent, it could be an ex that you have to co-parent with. Like, what should the people that are affected by this do, and what should they avoid?
Yeah, well, I mean, boundaries are really important. And as someone who was diagnosed myself with borderline personality disorder 13 years ago, and which started my journey to becoming a therapist, um, boundaries are so important. And I really couldn't handle boundaries when I was active in my disorder. And they are still absolutely required because the pain that this deep emotion can cause other people is pretty significant. So boundaries are crucial. Now, boundaries are important to protect the person who's being harmed that doesn't have BPD, but the best way to protect the person that does have BPD that you might love or be working with is to really dive into understanding what is happening on that neurobiological level. And two really, really important points to make is that facial expressions and tone of voice impact people with BPD so significantly. And that's part of the problem with the field too, is there is a lot of stigma within the mental health field and clinicians don't realize that their tone of voice and the facial expressions that they make non-verbally and potentially unconsciously can and do affect their BPD clients. And that's not just say that they're causing harm, but that more education and understanding, if you are actively treating someone with BPD or if you think your client might have BPD, is knowing that tone and facial expression is more important with these individuals than perhaps with the general pop depression and anxiety clients. And the reason for that is the amygdala is hypersensitive. And so that's what makes it so difficult for people with BPD is they try to stay calm and engage in these relationships and work on their skills, but they are triggered with that tripwire when they really don't want to be. And so it really becomes a debilitating emotional disorder where you turn left, you turn right, you go inward, you go outward, and everywhere there is this just this pain that you experience. And so having your support people understand what those tripwires are, which sounds like walking on eggshells, but it doesn't have to be that. It can be an awareness of how to work with these people, boundaries around these individuals, and just an awareness that if it's too difficult, I understand walking away because if you can't handle it, then it's going to hurt them more. But there is potential for healing, and it takes partners, parents, friends, colleagues, coworkers, therapists who are patient and understand that this is going to take a significant amount of time, but to not put in more effort than the person with BPD because those emotions will get in the way.
Mm. So you started your journey from your own diagnosis, and then from there you open a clinic. Tell me about the clinic and the rehab and what that looks like. And I know it's one of the first in the country that really focuses on BPD. And like, kind of what was the inspiration for it? What have you learned in the process of opening that facility? And yeah, let's go from there.
Yeah, so I started working in addiction treatment in 2014, and I worked at a Malibu center for 4 years, and then decided that I wanted to open up more boutique style treatment centers that really just honed in on a specific population. So my first center was open in Santa Barbara, California from 2017 to 2021. And at the end of those few years, I became the truth doctor through the pandemic on TikTok and the internet, and that really blew up to the point where I was really open about having borderline personality disorder in a way I never had been before. That was the point of me becoming the truth doctor, was to tell that truth. And so the first center that I had only focused on addiction because I was really still, I felt like working on some of my own borderline recovery. It wasn't to the point where I wasn't able to do my clinical work, but part of that was because I wasn't specializing in what it was that I was needing some support in. Then I sold that center to really focus on the millions of people who were constantly asking for input and advice. And what I realized was that there really was a lack of clinical education online around borderline personality disorder from someone who actually had lived experience and clinical knowledge. And through my creation of videos and my offerings online, there were just so many people wanting real help. And I also realized throughout working in the treatment field that there were so many clients that had borderline traits or borderline personality disorder in addiction treatment centers that they did not know how to treat it. And while they were trying to treat the addiction, they weren't treating the BPD, and the people just simply weren't getting better. And they weren't wanting to exist. They were experiencing heightened levels of suicidality. And these people were, DMing me and excuse me. And these people were DMing me. And of course, I'm not responding, but I'm like following these journeys of people they don't even know I'm following all around the world and realizing that there needed to be a place where adults could come that were experiencing substance use issues, but that the cause of it, the core problem was borderline personality disorder. So I looked into a lot of the research and I really could not find a center that specialized in these two things in one human being. And so I trained my staff on how to work with these two conditions. And we've also fed in neurodivergence and CPTSD as the combination of those two conditions as well can look a lot like the symptoms of BPD. And so at Exist Centers, it's located in Laguna Beach. This is what we do. We take no more than 12 clients. We provide them highly specialized DBT, ACT, IFS, mentalization, and schema-based therapy. And we work with them on preventing relapse for their substance use because they are starting to understand how their brain works on a fundamental level.
Mm. As a therapist, I can tell you from experience that having the right EHR is an absolute lifeline. I recommend using Therapy Notes. They make billing, scheduling, note-taking, telehealth, and e-prescribe incredibly easy. Best of all, they offer live telephone support that's available 7 days a week. You don't have to take my word for it. Do your own research and see for yourself. Therapy Notes is the #1 highest rated EHR system available today, with a 4.9 out of 5 stars on trustpilot.com and on Google. All you have to do is click the link below or type promo code Joe on their website over at therapynotes.com and receive a special 2-month trial absolutely free. Again, that's therapynotes.com and use promo code Joe on the website. If you're coming from another EHR, Therapy Notes will also import your demographic data quick and easy at no cost, so you can get started right away. Trust me, don't waste any more of your time and try Therapy Notes. Just use promo code Joe at checkout. What are you seeing? Like maybe what, having kind of dove so deep into this work, what are you seeing that maybe isn't typically taught in grad school?
Wow, that's a great question. Yeah, I think it's that what's not taught in grad school, right? Like you can dive into the research and find it, but what's not taught in grad school is I think the level of I think is the real understanding of suicidality when it comes to BPD. And I think that that's the biggest fear that clinicians have actually is we learn in school that BPD has such a high risk of suicidality and such a high risk of clinician splitting where the clinician is afraid of their license. And I think a real true understanding of what suicidality means for the person with BPD is something that you really only get to understand when you fully work with someone for a long time. And what that is, on a very high level, what that understanding is that suicidality itself is a baseline for individuals that have this level of sensitivity and impulsivity in their brain. My book, Your Unconscious is Showing, talks about the concept of learned helplessness and how we don't actually learn it at all. And that the researchers that developed learned helplessness 50 years later said, sorry, we actually were wrong. And for the most part, we don't learn helplessness, we learn control. And helplessness is our baseline. If you think about it, when we're born, we're completely helpless and we learn how to control ourselves and our lives. And so, this helplessness state that people with BPD find themselves in is actually a reverting back to their core existence, where they do, in fact, feel so wildly out of control in comparison to other human beings, out of control of their emotions, their experiences, and their behavior. And so the goal when someone is actively, well, the goal when someone's actively suicidal or has chronic passive suicidality is to teach them really small moments of feeling in control versus trying to get them to process psychoanalytically why they may be so depressed, feel worthless, hopeless. It really is the brain needing to have a trigger of control. And I think that if that was brought into the conversation when clinicians are learning about BPD in grad school, they wouldn't just be taught that BPD is just this explosive problem. They can be taught about the tripwire and about what that can lead to and about how to actually work with the suicidality. And I think a lot more people would be open to treating people with BPD.
Mm. Yeah, because I think there's sometimes this idea that like personality disorders are fixed, they're not going to change. It's more just how do you learn to deal with people that have them? Like that's the narrative that I often heard in grad school and even in my trainings afterwards.
Yeah.
Um, Versus like what you're saying, which like there is hope to live a fulfilling life as someone with a personality disorder,
Mhm.
and for the people around them.
Yeah.
How do you think that can shift where people can start to see like that there is hope around this and there are ways to kind of change the thinking? Like I think you even said how much you were living in your diagnosis. I don't remember if that's exactly how you said it, but that idea that it may still always be there, but it's not going to be something that has to manifest in the same way that it always has.
Yes, exactly. And clinicians who are even skeptical of my ability to do my work, which is usually before they've heard me talk about it and they've only heard about what my diagnosis is, I don't say that I have borderline personality disorder anymore, but I do say that I have borderline personality. And what does that mean? What that means is that I have an awareness of my brain. I have created an observer. I have grown my ability to be conscious of my unconscious, which is the whole premise of my book. Your unconscious is showing. And really what it is like it is possible to see yourself and your behaviors. And that is why I believe that people can truly get better. Like consciousness, awareness is something that is so difficult to grasp when you're having these highly emotional experiences, but it isn't impossible. If you are alive, you have consciousness. And if you have consciousness, then you have the potential to control yourself. There's just no if, ands, or buts about it. Fundamentally, as a human being, the potential is there. It's just finding the right way to maneuver and find it. So for me, I say I still experience passive suicidality. It's just the way my brain works. Am I suicidal? No, I'm not. It's not this visceral, psycho, analytical narrative that I'm telling myself that I'm unhappy. It is a part of my brain that I know is there and that I'm aware of that I keep in my pocket. It no longer has control over me, but it's there, it's present because it's just simply part of my existence. I can see when I'm experiencing physiological increases of anger or arousal in general that could lead to irritation or whatever it is. And it's this awareness, this cultivation of consciousness, which may sound woo woo, but on a real level is I'm just using awareness to know myself. And so it is possible to do that. If you think about someone with really severe PTSD, the mechanisms in the brain, sure, there may be some brain parts that are causing, or sure, there may be some different brain parts causing similar behaviors, but it is workable. If we believe in neurogenesis, if we believe that the brain is malleable, then it doesn't make sense to believe that personality disorders are fixed.
Mm, so awesome. So I'm wondering when you jumped on TikTok, first, like why? Because you were one of the first 10 therapists on there. And I think so often we hear of these new social media platforms and you never know which one's going to take off. And so how did you think through jumping onto TikTok? And then what did that look like when you first started sharing on there?
Yeah, so I started my journey of becoming the truth doctor only on Instagram, and I was actually following the footsteps of the holistic psychologist back in 2019, which was one of the primary therapists on there at the time. I'm sure we all know who Nicole is. And I just thought this is so cool that there's a therapist on here sharing information. I want to tell my truth, which is pretty bold that I did meth at 15 and have been, was unfaithful for a long time in the beginning of my marriage and had borderline. And it was a really bold thing for a clinician to do. And doing that on Instagram didn't quite make as much sense when TikTok was a platform that was really about authenticity and unique personalities. So my cousin, who was a social media manager, said, "You belong on TikTok, and there are no therapists on there right now." And so I went on and I saw that it was funny and that people were being really human and also that people were really struggling. Moving into 2020, TikTok became a place where people were brutally honest and authentic and were seeking and finding significant connection and healing throughout this difficult COVID pandemic that we all experienced. And so when I went on, I fit right in. I mean, I leveled the playing field for the people who were on TikTok who had an understanding of therapy or therapists that were rigid, strict, sterile, simply professional, wouldn't understand you, don't have a life outside of their four walls of their therapy office. And people really attached to the fact that therapists were humans. And I created the phrase human first, and people got it tattooed, and my platforms blew up. And it really started this shift, which I don't talk too much about, but the whole human first movement that we see all over the therapy field now started from TikTok therapists being brutally human and dancing to Snoop Dogg and saying cuss words and admitting their truths and that they were struggling just as much as everyone else was through the pandemic, but were there to provide support. So it was a really wild journey. And I certainly did not expect at 22 years old, when I was diagnosed with borderline personality disorder in a psych ward and substance detoxification hospital, that I would be admitting my diagnosis to millions of people in the middle of a global pandemic and have that result in a shift in understanding of the diagnosis that I suffered from for so long.
Yeah. I mean, I'm wondering what that shift for you when you think about kind of that old way of like, the therapist being the blank slate, you don't share too much about yourself. How has that felt to then move into saying like, here's who I am authentically, and it doesn't affect my ability to help you as a therapist?
Yeah, it has been so incredibly rewarding. The work that I have been able to do since I became licensed is incredible. There is something that happens when you can prove to someone, whether that is a colleague or a client, that you have some of these symptoms or have had some of these experiences and that it makes you better at your job. And of course, there's saying that, and then there's proving that. And mostly you prove that to clients. And when I'm sitting in front of a client who doesn't believe that they can get better, being proof that they can, obviously, in my own anecdotal way, is incredibly helpful. Because if you have BPD and you Google help for BPD, the majority of it is very scary, or it tells you that you're not going to get better, or is only help for the people that you may have harmed. And so it's made a huge difference. And one question, kind of on top of that, that I get a lot is, what do clients think about you talking about your own passive suicidality and your own drug use and your own things that you're dealing with in your life online? Do they bring that in session, or do you? And I don't. And I never have. And clients actually don't ask because there's no need to be curious, because the way that I talk about it online is through the lens of how it can help them. There's no just rants, there's no explosions of like, I'm having a hard day. If I do come and share, there's a couple things that I ensure. One, I've already processed what it is that I'm going to talk about. I'm not actually using the internet for emotional release. I'm using it to turn emotions into education. And also, I make sure that I don't talk about the things that I don't want my clients to know. And that's not being truthful or authentic, it's being professional.
I love that. The idea of already processing it and, things you don't want your clients to know. There's a couple that I interviewed earlier this summer. I don't remember off the top of my head what their names were, but they were talking about how when they have a podcast all about couples work, and they talk a lot about their own stuff. And I asked them a similar question, and I remember they said along the lines of, "We don't bring things here that we're still kind of in the midst of. If they're going to have a conversation, it's got to be something that's not going to like explode on the podcast." So that
Right.
same idea of like, yeah, we want to be already processing this or kind of reflecting on it, and that idea of like, I don't want to say things here that I don't want my clients to know.
Yeah.
Same sort of thing for me around my divorce and co-parenting with my daughter's mom. I don't say things on the podcast that I wouldn't want my daughters to find out about,
Right.
and only things that they already know what I talk about on here, because to me it's important that the audience doesn't know something my own kids don't know. Like, it just seems a
Yes.
little off. So I'm hearing things that are kind of universal to like being public about things in your private life as a therapist, and that's like
Yeah.
that you're processing through things outside of there. You're not just using the internet to process it. That you know, I would hate to see my own therapist say, "Boy, I woke up cranky this morning. I really don't want to go into the office. I guess my clients are gonna have to put up with me today."
Exactly.
Like, could you
That's
imagine them going into
terrible.
a session and seeing that therapist?
Yeah, see, that's unprofessional, and that,
Hmm.
it's knowing the line. Like, you
Hmm.
aren't doing a great job as a therapist if that is, in fact, what you're doing on the internet.
Well, and even if you think about if you're even an admin assistant or something like, boy, I just don't want to go into work today. Like, what does that tell your boss? So I think that there's just this kind of approach to the online world that sometimes like isn't always thought through.
Yes.
So I have a couple more questions before we wrap this up. But thinking about therapists that are skittish about sharing online, I think you gave some great tips, like already process things, anything you wouldn't want your clients to know, don't share that. Are there any other kind of first steps when people are nervous, they haven't really shared much online, ways that they can think through what they're going to post content wise, to just take a step into it?
Hmm. Well, I think part of it is right now, the therapists that are succeeding are showing their face, doing dances, and like really, really putting themselves out there. And it's easy, I'm sure, just as humans in general, to think that that's where you need to begin. But one thing that I think is super helpful is someone that you admire, someone whose content you wish you could be producing yourself. Scroll back to the beginning of their platform. Scroll back
Mm,
to when they only had copy and graphics. Scroll back to their very first on camera video and just accept the fact that it doesn't look like it probably does at the very top of their grid right now, and that there was a process of exposure and learning about how you show up on the internet. And so to allow yourself grace, I think is really important. And I think, it's not a tip, but maybe a piece of advice or a perspective to take is you will change. In my opinion, as a clinician, when you really start putting yourself out there on the internet. And the reason for that is it doesn't only cause you to create your professional identity, it causes you to think about your own personal identity. And we don't really think about that in grad school. We're going to have to come up with a branding palette for our graphics on Instagram. Like, no, but it says a lot about who we want to attract and what we're really putting out there. So just take your time. We aren't in the middle of an intense moment of a pandemic where we are rushing to get content out there to help people. But it's still, if it's important to you, like give yourself the grace and the space to show up online because it doesn't disappear when you put it on the internet. And so take a little bit of time to think about it. And please do, if you're thinking about going on the internet, go on the internet. We need more voices of people who understand aspects of mental health in their own way, and it will help you find clients. So,
mm.
good luck.
Love it. The last question I always ask is, if every private practitioner in the world were listening right now, what would you want them to know?
People with BPD need your help, and they hear you, even if they say they don't. And if you are open to potentially working with people that have BPD after listening to this episode and you have questions, please DM me and please start reading the research because, as I just said, people with BPD need help. And we are here, they are here, ready and willing. So thank you for the openness.
Mm. So awesome. If people want to follow your work, if they want to follow you, learn more about you, read your book, where should we send them?
You can find out more about me at thetruthdoctor.com or on TikTok, Instagram, YouTube, and Snapchat at the.truth.doctor. My book is called Your Unconscious is Showing. Take control of your life using the 12 steps of consciousness. It talks about my journey from BPD to becoming the Truth Doctor. And then my clinic is called Exist Centers, and it's located in Laguna Beach, California, and treats adults with substance use, BPD, and neurodivergent CPTSD conditions.
So awesome. Well, thank you so much for being on the Practice of the Practice podcast.
Thank you so much, Joe. Have a great day.
You know, as we interview people on this podcast, it's so clear just how many paths there are. You know, in grad school, we often kind of hear the very typical paths, and those are good to learn. Those are like, we want to have people have a basic foundation. But as a professional, you can learn to do things differently. You can push the limits. You can push to just say, look at our ethics and say, like, are these even up to date anymore? We need to talk to our governing bodies and push back in areas where we see that people need help. There's advocacy work, there's educational work, there's just human work that needs to be done. And that's not always going to fit in the box of what we were taught. And I think that that's the thing that over and over I see people that are, you know, finding that overlap between enjoying their career and helping the world and making a sustainable living. That kind of Venn diagram of those three things is often people that, you know, dipped their toes into something scary, that they said, you know, this is a new platform, TikTok, I'm going to jump on in there. I'm going to just continue to try different things. Those are the people that I see be most successful. And, you know, to be able to do that in community is so important. That's why our membership community over at Practice the Practice can help you with our different tracks, whether you're just getting started, whether you're starting a group practice or growing a group practice. We have a track for you that's going to walk you through exactly what to do with our live meetings. We have 12 live meetings a month that are an hour each to help you at different phases of practice. You can read more of that over at practiceofthepractice.com/membership. You know, we also couldn't do this show without amazing sponsors like Therapy Notes. Therapy Notes is the best electronic health records out there. They will help you switch over from your current EHR. They also give you 2 months for free or just money off if you use promo code Joe at checkout. They are phenomenal. They help with automated billing. It's going to make it easier to outsource your billing. So many reasons to switch to Therapy Notes. Just head on over to therapynotes.com, read about it, and at checkout, just use promo code Joe. Thank you so much for letting me into your ears and into your brain. Have a great day. I'll talk to you soon. Special thanks to the band Silence is Sexy for that intro music. And this podcast is designed to provide accurate and authoritative information in regard to the subject matter covered. It is given with the understanding that neither the host, the producers, the publishers, or guests are rendering legal, accounting, clinical, or other professional information. If you want a professional, you should find one.